Mental health problems such as depression and anxiety disorders have consistently been linked with child abuse and neglect, particularly for adolescents. Prevalent rates of major depression have been shown to be approximately 4 times higher in adolescents than young children. In a review of 7 large-scale studies by Harkness and Lumley, all studies showed high association between child abuse and neglect and depression in adolescents. So that also manifests in concepts like self-harm and this numbing out, and so cutting to remind themselves they're alive, seeing that they're alive, the cuttings and the dissociation from the emotional pain, those sort of things. Attempted suicide, drug use, all that sort of stuff is masking or disassociating from the issue that they've been dealing with. And they feel they've got no parameters or trusting relationships to go, hey, this is happening for me. For example, in a longitudinal study by Brown, Cohen, Johnson, and Smales, children and adolescents who reported a history of abuse or neglect were 3 times more likely to exhibit depressive disorders than non-maltreated children. In a Victorian study of characteristics of children referred to therapeutic health services for children who have been abused or neglected, Take 2 program, 62% of the children met the criteria for at least one mental health diagnosis. So it's an alarming statistic, but it's the ongoing effect. So the abuse has happened, but then there seems to be this ripple ongoing effect, affects attachment, affects relationship, affects these learning and cognitive and behavioural things, and then ongoing, and it creates an anxiety and behavioural issues for adolescents, and they take that on into adult life if not treated well, if they make adult life. Put that in there.